Have you noticed your furry friend acting a little off lately? Maybe they're suddenly drinking a ton of water, or maybe they seem more tired than usual. As pet parents, we're always tuned into our dog's well-being, and sometimes subtle changes can be a sign of something more serious, like diabetes. Today, we're going to talk about the key signs that could indicate your dog has diabetes. Knowing what to look for is the first step in getting them the help they need. First, let's understand what diabetes in dogs is. Just like in humans, it's a condition where the body can't properly regulate blood sugar levels. This happens either because the pancreas isn't producing enough insulin, or the body's cells aren't responding to the insulin that is being produced. Insulin is a crucial hormone that helps move glucose, or sugar, from the bloodstream into the cells to be used for energy. When this process breaks down, sugar builds up in the blood, leading to a host of problems. So, what are the most common signs you should watch out for? The classic signs of diabetes are often called the 3 Ps: polydipsia, polyuria, and polyphagia. That's a mouthful, I know, so let's break it down. Polydipsia means excessive thirst. You might notice your dog's water bowl is empty way more often than usual. They might be drinking constantly, almost like they can't get enough. This happens because the excess sugar in the bloodstream pulls water out of the body's tissues, leading to dehydration and an intense thirst. Next is polyuria, which means excessive urination. What goes in must come out, right? All that extra water your dog is drinking has to go somewhere. You might find you're letting them out to pee much more frequently, or they might start having accidents in the house, even if they've been perfectly house-trained for years. The kidneys are working overtime to flush out the excess sugar from the blood, which results in a lot more urine. The third P is polyphagia, which means excessive hunger. This one can be confusing for owners. Your dog is eating more than ever, maybe even begging for food all the time, yet they might be losing weight. How does that happen? Well, even though there's plenty of sugar in their blood, the cells can't access it for energy without insulin. So, the body thinks it's starving and sends powerful hunger signals to the brain. Your dog feels ravenously hungry, but the food they eat isn't being converted into usable energy, which leads to our next major sign: unexplained weight loss. Weight loss, despite a voracious appetite, is a huge red flag. If you notice your dog is looking thinner, you can feel their ribs or spine more easily, and they're eating you out of house and home. It's a classic combination of symptoms for diabetes. Their body is breaking down fat and muscle for energy because it can't use the sugar in their diet. Another common sign is lethargy, or a lack of energy. Does your dog seem more tired than usual? Are they less interested in playing fetch or going for walks? This fatigue is a direct result of their cells not getting the fuel they need to function properly. Think of it like a car running on an empty tank of gas. Even though the tank is technically full, their body has plenty of sugar, but it can't use it. You might also notice changes in their appearance. One sign is a dull or thinning coat. The body is diverting resources away from non-essential things, like skin and coat health, to deal with the energy crisis. A more serious and often later stage sign is the development of cataracts. High blood sugar can damage the lens of the eye, causing it to become cloudy. This can happen very, very quickly in diabetic dogs, sometimes seemingly overnight. These cataracts can lead to vision loss and even complete blindness. If you notice your dog's eyes look cloudy or bluish-white, or they start bumping into furniture, it's a critical sign that needs immediate veterinary attention. So, let's recap the main symptoms: excessive thirst, frequent urination, increased hunger, unexplained weight loss, lethargy, a poor quality coat, and cloudy eyes or vision problems. It's important to remember that your dog might not show all of these signs at once. They might just have 1 or 2 to start with. What puts a dog at risk for diabetes? While any dog can develop it, certain factors increase the risk. Age is one. It's more common in middle-aged to senior dogs, usually between 7 and 10 years old. Female dogs are also diagnosed more often than males, especially unspayed females. Obesity is a major risk factor, as excess weight can make the body's cells more resistant to insulin. And finally, genetics play a role. Breeds like Samoyeds, Keeshonds, Poodles, Pugs, and miniature Schnauzers seem to have a higher predisposition. Now, this is the most important part. If you notice any of these signs, do not panic, and please do not try to diagnose your dog yourself. The only way to know for sure if your dog has diabetes is to see a veterinarian. They will perform a physical exam and run some simple tests, usually a blood test and a urine test, to check for high levels of glucose. If your dog is diagnosed with diabetes, I know it can feel scary and overwhelming, but please know that it is a manageable condition. It's not a death sentence. With proper treatment, which usually involves daily insulin injections, a specific diet, and a consistent exercise routine, your diabetic dog can live a long, happy, and active life. Your vet will be your greatest partner in this journey. They'll teach you everything you need to know, from how to monitor your dog's blood sugar levels to how to give insulin injections. It might seem daunting at first, but you'll quickly get the hang of it, and it will become a normal part of your daily routine. Managing your dog's diabetes is a commitment, but the bond you'll form while caring for them is incredibly rewarding. The key is early detection and consistent management. The sooner you catch it, the better you can prevent complications like cataracts or a more dangerous condition called diabetic ketoacidosis, which is a life-threatening emergency. That's why being aware of these signs is so incredibly important for every dog owner. So, keep a close eye on your furry companion. Pay attention to their habits around their food and water bowls, their energy levels, and their bathroom breaks. You know your dog better than anyone. If your gut tells you something is wrong, trust it, and make that call to your vet. It's always better to be safe than sorry. Thank you so much for watching. We hope this information helps you be a more informed and proactive pet parent. If you found this video helpful, please give it a thumbs up and consider subscribing for more tips on keeping your pets happy and healthy. Let us know in the comments if you have any experience with canine diabetes's story could help someone else going through the same thing. Stay safe and give your dog a big hug from us.